Hello, my name is Connie, and my presentation is going to be on laboratory information systems. Just to give you a little background about myself, I've been a laboratory technician for about 25 years. So I know a lot about this subject. My first laboratory that I worked in did not have a laboratory information system. We mainly did all our information was recorded on paper by hand. We did have automation as far as testing is concerned, but as far as a way to go and look up previous results or results, we didn't have anything available at that time. So it was in my first laboratory. I was introduced to my first laboratory information system. And at first I didn't appreciate it, but later on I came to actually love it. So we're going to go through a few things. I'm going to get through this as quickly as possible because I know everyone has other presentations to look at. We're just going to talk about laboratory information systems and what are the best things or what we need to know to choose one if we end up in that situation. Okay, if I ask you right now, what would you use to check the weather? Order a pizza, or check your bank account balance, or deposit a check? Most people would say their phone and Google. Well, with the exception of my mother, because she doesn't have a computer and she's not really good on her smartphone yet. But most people would go look on their phone or use Google to do any of those things, along with a plethora of other things. Okay, laboratories use the LIS in the same way we use our smartphones and Google today. They're a one-stop shop. We can get almost everything done that we need to do. They don't just store information. So uh, a lot of people, or when healthcare information systems began, basically they were a place to store results, which is great because when a doctor is calling for information or you need some information, it is an organized way you can get that information. And before that, file cabinets were hard to go through. But now they not only store information, but they manage your workflow. So basically, from start to finish, it can track a specimen once it comes into the laboratory all the way till the end, or anything needed in regards to following up. And we'll talk more about that later on in some upcoming slides. Also coordinates day-to-day activities, and some of the examples of those activities are test order receipt and management. Basically, like I said, from start to finish, where that sample is when it gets to the laboratory until the result is sent out. Asset tracking, basically what other laboratories we have, what else capabilities that we have in the laboratory. Task segmentation and distribution. For example, you can take one sample and it can be utilized in one section of the laboratory, but it also may need to go to another area once it's finished tested in a particular area. For example, a urine sample could be utilized in UA. You do your UA testing dipstick, and then once it needs to be tested for a culture, it would have to be sent to microbiology. So we have to be able to track that and know that that's what needs to be done with that sample. Of course, quality assurance and other regulatory requirements. The laboratory is under very strict standards depending on who they're regulated by. Most of them, the bigger laboratories, are regulated by the College of American Pathologists, so those can keep up. Our laboratory information systems can keep up with those type of standards and let us know when we don't follow in those regulations. But our information systems have to have the capabilities to be able to meet those standards that are set by those College American Pathologists or whatever certifications you are accredited through. Okay, the history of the laboratory information system. Most people would think that the electronic healthcare record came along first, but no, actually, laboratory information systems came along first. And I think the reason for this is because of the automation that takes place in laboratories. We have definitely went almost all automated. We do have some manual testing, but we utilize a lot of automation. So there was a need there a greater need for laboratory information systems before. We have a lot of information, a lot of results and stuff that we have to take care of. So that's probably why it was started before the electronic healthcare record. It was created, as you see here, to manage information, first of all, maintain quality assurance, and most of all is to reduce error. It's a system of self-checks, checks and balances. When you put a result in, it doesn't add up in regards to maybe a previous result, it'll give you an alert. There are many ways the way it checks itself, and it reduces errors constantly because it's always looking for previous information and checking itself. So it's definitely reduced errors in the area of laboratory procedures. Okay, choosing the right laboratory information system. Today, the focus is improving laboratory operations in pre and post analytical phases. Just as I said before, the during analytical phase is mostly done by automation anyway, so there is not as great a need to look at those areas where we saw most of the errors that were made were in the pre and post. So basically information, sampling or collection errors, and then after that reporting errors. So the actual testing phase is not error free, but it is an area that is not focused on as much. When we choose a laboratory information system, it's important that the pathologist and the laboratory staff is involved. A lot of times that is not the case. Hospital administration or your IT department get together. They may get us in on meetings and take our opinions, but ultimately they make the final decision. That would probably be the case in most hospitals, but it's very important the pathologist and the laboratory staff are involved in this decision. It's like buying a car. Would you want the car dealership to choose the car for you, and you go show up because they have no idea what you need, if you have a large family or what. So it's the same concept. Even though we're not spending the money, we are the ones that are going to be utilizing the system. So it's very important that we are put in the position to be able to help out with the decision to be made as far as the laboratory information system that is chosen. Okay, here is a list of the components that need to be taken into consideration when choosing a laboratory information system. Here's a list of about 12. There definitely are other things that's going to be looked at depending on the how large your laboratory is. So we're just going to touch on each one of these and go through these, and I'm going to describe these to you. The first area we're going to cover is information security. You can have security from internal, which is basically employees that might be looking up results for other employees or their neighbors or anyone that they're not supposed to be in. External threats could be someone from outside of the laboratory or someone outside the system trying to get information. Another thing you're going to be looking at is you want an information system that does not hinder with functionality, but basically you want it to be secure, but not a process that's so hard to get into that it's Fort Knox and it takes you forever just to log into your computer. You're going to have different levels of security needed depending on you. So basically, you might have a provider that would be able to see more information than maybe someone that was in the clerical position, or maybe someone that was sitting at the front desk. So they might not be able to go into certain areas that someone else can. Secure interfaces should have advanced login capabilities. So those interfaces, for example, in the lab, would be those instrumentation that may not be anyone else might not have capability to go into. Those still have to have security systems on them as well if they're interfaced with your laboratory information system. Secure locations should be available where live reports can be displayed. This is as simple as having, if you have a system of showing what stats are, what is pending, and you have a monitor, it needs to be in a place where no patients are able to see. Laboratories have phlebotomy areas where a lot of patients go in and out of, but you want this system to be away from those areas. Test ordering. This area needs to be the most amenable. Once this is in place, it probably will change several times depending on what type of clinic, laboratory you are running. Different test menus are going to take place. Sometimes you'll add tests, sometimes they will be taken away. So you need to be able to go in the system and change these test menus at a moment's notice. Also, cross-checks with the healthcare information system need to be able to be done consistently for discrepancies and things such as like names or birth dates. Must be user-friendly. You also need to have ordering restrictions. This means that a provider might be able to order specific tests that a nurse might not be able to order, or also an MA. There's some providers that might not be able to do certain things that others are capable of doing, and you need to have those restrictions in place. Identification of research versus patient care samples. This is important due to billing. Patient care samples, you will bill the patient or the insurance company, and we need to be able to go in there and be able to identify those samples that are research, because they will be billed a different way. Interacts between other systems for test retrieval. For example, you might have another system in place for the electronic healthcare record. The provider goes in, places the test that they want to be done, and it should be able to interface with the laboratory information system and retrieve those tests and pull them from that EHR and see those tests that need to be done. Interacts between other systems for test retrieval. That's what we just talked about. Real-time feedback. We want to be able to see what's going on with that sample at all times. Where is that? If we look at it in the afternoon or the next day, where is it in the processing? Capability to split orders. Some tests will be done in your laboratory. Some may be split up and sent out to other laboratories. The LIS needs to have the capabilities to know what tests need to be done in your laboratory and what may be sent out or to different areas of your laboratory. Specimen collection, accessioning, and processing. This is probably one of the most important areas to the laboratory, because this is where the cycle begins. This is where it all starts. Specimen collection lists must be institution appropriate. We talked about this before. Different establishments, different types of clinics are going to have different types of test lists depending on what their capabilities are and what tests that are needed for their specific patient care. A guided process from collection to processing. You need to be able to know what the next step is in the process of taking care of that sample. For example, if you have a urinalysis test, you may have to do the test, and then there may be another additional test that need to be done and need to be taken to a different area. The LIS should guide you through that whole process. Barcoding systems are very important because that barcode is specific to that test, and we're able to utilize that barcode to see where that test is in the process. We can pick up any sample that has a barcode on it and scan that barcode and get any information that we need about that particular specimen. Support by directional interfaces. We also are going to have point of care testing, small like glucose meters, other tests that can be done at the actual bedside. We need to be able to interface those systems with our LIS and retrieve that information from those point of care testing analyzers, just the same way we do with the larger ones. And then there's a whole lot of other functions that specimen and collection and accessioning and processing are capable of doing, but this is a key area. This is the beginning where a lot of the mistakes are made, because if a specimen is not collected, accessioned, and processed correctly, it makes a big difference in the quality of the results that we're going to give the provider, and also ultimately the care that we're going to give to the patient. Okay, now we're going to move down to analytic phase. As I said earlier, this is not an area where we see a lot of errors. So most of the information are on these systems. We don't have to worry about it. All we need to know is that these analyzers are interfaced with our LIS, and they bring those results over into our LIS correctly. So that's the main function. associates with manual assays, we also still do manual testing. So we have to be able to go in and put in tests that we actually do manual along with those results that come directly from the analyzer. Document control system, we need to be able to have a way of looking at SOPs or manuals. They need to be able to be put into the LIS. So you not only have a hard copy, but you also have a place where everyone can go. And that would be the function of the document control system. Your provide instrument information, that will be on the LIS as well. So any information about that analyzer, whether it's maintenance or controls, all that should be able to be found in that LIS. Create workloads list and pending list. So basically you want to see what you have tests that you are going to have to do and categorize those depending on what department it is. And then at the end of the day, you need to be able to see what you have left to do. So a pending list, what tests have not been resulted and where they are in the process. Result entry and validation. We need to be able to see our results or place our results and enter them into our LIS in various different formats. We need to be able to do automated and manual entry, different levels of result certification. So once a result is entered into the LIS, it has to be approved or certified. We need to have different levels of certification depending upon the test. So sometimes we have tests that have to be reviewed by a supervisor depending on maybe a critical or something that is seen on the slide that they want verification before that test is entered, or it might be something that doesn't line up with a previous result, and those results have to be reviewed and have to be certified depending on the level of the user. Receive results in different formats. We already talked about that. Auto validation. At some point now, they have it where if everything looks good to go, the system can send test results over if there's no issues and they don't see anything wrong with the sample. The LIS system itself will go ahead and approve. An example is that if you have a complete blood count and nothing is flagged, everything looks good to go, the LIS system will go ahead and approve those results, and those results can automatically go out to the patient's record or to the provider without the laboratory technician even having to review it. Delta checks is basically what I had talked about earlier, where a result may look completely different than what a patient's result had been in the past. So it flags the lab technician or the user and lets them know there's something not right with this. This patient's been running at this level. Now all of a sudden it's sky high. That gives you an idea there could be something wrong with the sample, could be numerous things. Also, reflex testing is, for an example of that would be a urinalysis coming up positive for bacteria or for white cells. Then you would want to go ahead and do an additional testing. So reflex testing would be if a certain result comes out for a test, then there would be another test that would need to be done. Okay, we're going to have different types of results reporting. You want to have a different variety. You're going to have graphs, and sometimes you're just going to have numbers. You're going to be able to configure them in different types of measurements as well. So the LIS has to have that function capability. You have to have pre and post test diagnostic information in there. So you want to know what's going on. Like, for example, if a patient fasted for a test for a lipid panel, you would need to have that information available. Here is a graph here of a physician's office clinical laboratory and how the flow of information goes through a system which is called here the Orchard Harvest LIS, which is a very popular system used in laboratories. It's a standalone system, and basically it's giving you the flow of information. You have the electronic health care, which has the health record, has the orders. They are passed from that EHR down to the LIS, and once the laboratory instruments once those tests go into Orchard, we go ahead and do the test if we're capable of doing them in that laboratory. If not, then they're passed on to either the local hospital, as you can see on the one side, or they can be sent to a reference laboratory. Once those are resulted out, then they go back again out to the practice management system. Okay, notification management. The LIS should have a sophisticated significant result notification system. Basically, we need to be able to notify providers if we have abnormal results, not just through a phone or going to tell them. They also need to be able to alert it through the LIS. There needs to be a system in place and have set parameters when a provider is notified. We have to have relevant identification of true positives. So basically, if you have if someone's been running at a certain level for a specific test, and then all of a sudden they go higher in a result or lower in a result, the provider needs to be notified as well. Rules-based notification of third parties. So this is basically your faxing. A lot of LIS has automatic faxes. We have to set something in place where there's rules set in place where only certain values or certain reports are sent to certain areas or clinics or third parties. Corrections communication is if any time a lab test is corrected or a report needs to be corrected, there needs to be a system in place where automatically the provider is notified. And then end user inquiries. So basically, after everything is done, we need to be able to inquire and go back into any previous results to see if they correlate with current results. Data mining and cross-sectional reports. So this is just what you're going to need to do any type of research, and you're going to utilize this information to make your laboratory more efficient in operations. You're going to use it for clinical issues, specified populations, and case findings for research. So you're going to go in and take a bunch of data, and then you're going to pull out the data you need, and then you're going to correlate it together. You're going to look for patterns, and you're going to use all this information to be able to gain knowledge. So the LIS has to be able to store this types of data, be able to categorize it based off of what you're looking for. So you want to be able to go into that system and say, okay, I need to look for everybody with a date range for a specific test, everybody that had a cholesterol between the ages of 10 and 25, and then you take and utilize that information for whatever knowledge you're trying to gain to do research, and it can be utilized in different ways. And so that's why data mining is very important, and you need to have a system that's able to do this very easily. Method validation. Since the laboratory is definitely a automated area of the hospital, it is a lot of automation. We constantly have a different test coming into the laboratory depending on the needs of the laboratory. So we have to have a way of validating those. We also have to be able to take that information and correlate that information and utilize it to let us know if this test, we're going to be able to utilize this test. So that's what our LI system is going to do. It's going to keep up with the validation process, and it's going to guide us through that process and record the results. It's also going to be able to give us those statistics. So when we send it off to our accreditations or to the company of the analyzer that we might be utilizing in our system, they can correlate our results with other results systems in that same area and tell us if we're ready to go and up and running. So it also lets us know if we need to do any more validations for any future testing as well. Quality management is crucial for the laboratory in order to be able to provide quality patient care, and this is needed throughout all areas of the laboratory. So our LIS system needs to be of quality, it also needs to be able to manage our quality management system. And it starts basically with our quality control, how we make sure that our analyzers and our results are coming out correctly. And they're going to maintain all this information. If for some reason our results are not coming out the way they should be, the LIS keeps up with all this information and then alerts us when those quality controls are not in range. It also gives us information to compare us to other laboratories, so it's able to pull in information from other laboratories to see if we're aligning up with their test results as well. Interface with instrument performance data, making sure that our interfaces are working properly and that we're pulling the data that we need to from our instrumentation and doing it properly. Proficiency testing performance. That proficiency testing is basically when we're sent tests. So we're able to, they're unknown tests, and we run them on our analyzers, or we perform the test. We don't know the results. We result the test and then we send them out. So it's a way of them being able to see if our instrumentation is working properly and we're doing the test correctly. And we need a system that's going to be able to maintain those records and notify us when we're due for proficiency testing, so we can continue that quality care for the patients. Also, accreditation requirements. Most laboratories, I would say all laboratories, are accredited through some type of accreditation. Most of the larger laboratories are accredited through College of American Pathologists. There's some other accreditations are out there, such as COLA. That's another name for an accreditation. And the LIS system has to be maintained to a certain level to keep that accreditation. It also keeps us in line with everything that we need to do to maintain our accreditation. And it needs to have a user-friendly process of improvement system. So we need to be able to go in there and create quality management programs that are easy and ways to improve our laboratories. Administrative and financial and other operational issues. Ability to generate the necessary forms by using the appropriate codes for reimbursement. Very important when we're talking about money. We have to have the appropriate forms to go to insurance companies and to other areas to be able to get the money back for the testing that we've done. And we have to be able to create certain forms to do that, and our LIS needs to have those capabilities. We need to track cost of laboratory operations. This is very important so we can set our budget, so we know at the beginning of each year the money that we're going to need, and our LIS system needs to be able to do this. Workload statistics. This is going to help with staffing, also, supplies as well. And this is something our LIS system needs to be able to keep track of. And the inventory and materials fall into that as well. We already talked about document management system. They need to maintain manuals, any type of procedures needs to be able to maintain in our LIS. Personal management capabilities, scheduling, so then we were able to have the appropriate people on staff. This also can be a function of our laboratory information system. And finally, it needs to be the ability to process large amounts of data. We already talked about how we're going to have to do data mining to utilize that for research and other purposes later on. So it is an area where that is the biggest, where there's so much information that goes into it. And you're going to need to have a system that's going to be able to hold that type of information, those large amounts of information. Okay, standalone LIS versus embedded into EHR systems. The reason why I'm talking about this is because after you decide what you need in a laboratory information system, you have to decide whether or not you want this LIS to be in your EHR or you want it to be a standalone. This is something that a lot of laboratories have to deal with, most especially in larger hospitals. then that's why I said it's very important to include the laboratory staff, and most especially the pathologists. That has led, but when they have not done this, it's led to many laboratories having LISs that do not meet their specific needs. It all comes down to each laboratory, depending on their size, depending on their patient population. There's lots of things that need to be considered when choosing an LIS system, and one of the major functions is whether to have it incorporated into an EHR or just have one that functions as itself but interfaces with other healthcare information systems. So some of the things that there are many things that need to be considered when choosing whether to embed or to do standalone. Here's just a slide of the comparisons between the two. Your standalone is the cost of standalone, the LIS can be very expensive because it's specialized capabilities. That means you're going to have to bring on additional IT to be able to deal with the specificities of that particular system. When you have an embedded system, it's a little bit cheaper because you have one big system and you have a certain set of IT people that can run the whole system. But also when you run into that, they might not have the capabilities to deal with the special situations that a laboratory have. Also, the standalone LIS has more, they say you have to have more than one vendor is needed because of the software specific to laboratory, which is true. So once again, like I said, you're going to have more IT specific personnel on hand to deal with the particular issues that a standalone laboratory information have. They will have in different areas or different departments that have different special functions that need to be addressed. An embedded LIS and EHR claims to only need one vendor, but that's not always true because no matter, even if you have an embedded LIS, you have specific departments that need to have the capabilities to function with other agencies outside of their laboratory. For example, a blood bank has to be able to meet the standards of the Federal Drug Administration, Food and Drug Administration, and those. So that means there's going to have to be another interface so the information from your blood bank can be processed through the FDA. Lastly, the next two comparisons can be customized to meet the specific needs of the laboratory. So your standalone can be very specific. That's really not an issue when it comes to smaller laboratories, but your bigger laboratories, you're going to have a lot of departments that need specific things for that particular department. And then with your embedded LIS and EHR, it's going to be difficult to customize those because it's very general. Only certain capabilities that it's going to have. It's going to be more general capabilities. So there's good and bad with both. A lot of times it just comes down to cost, and it really depends on what the needs of the laboratory. Okay, in summary, the goal for any laboratory is to provide the best quality of care for their patients. We went through about 12 different components that are important to any laboratory information system. We also know that the LIS plays a role in every department of the laboratory, and all areas need to be considered when choosing an LIS. We talked about how standalone LIS versus an EHR embedded LIS is very important decision to make. At the end of the day, ultimately choosing an LIS needs to be based on the needs of the individual laboratory. All components need to be considered. It's a crucial decision that should involve those that will utilize the system the most, which are the pathologists and the laboratory staff. And I'll end with a verse, for the Lord gives wisdom, from his mouth comes knowledge and understanding. I thank you for your time, and remember, we need to love each other like God loves us. Thank you.